Welcome back, everyone. We want to do everything we can to ensure our pets are as healthy and happy as possible. So what vaccinations should I give my pet, and how often should they be given? Well, the answer depends on your pet and your lifestyle. Dr. Melissa Webster is here to tell us more. Good to have you here.
Well, thank you.
There are some, now, first of all, why do we need vaccinations in the first place?
Well, because pets can be unprotected against simple diseases, and in particular for us, rabies is a big deal. And we can die from rabies and get it from a cat or a dog, so vaccinations are important to protect pets.
Okay, now what vaccines should my pet have?
That can be a confusing question to answer directly, but bottom line, pets, we have core vaccines that are like base vaccines that every pet should have.
Okay.
And then,
well, we have canine core vaccines that we're looking at right now. So these are the ones you absolutely have to have for your dog.
Yes.
And at what age? And do they get them every so many years?
What happens with a dog is typically we start vaccinating at about 8 weeks of age, and we vaccinate each month until they're 16 weeks of age. In particular, like you'll see, parvovirus up there is really serious, and we want to protect dogs for that. And then with rabies, they'll get boosted when they're a year of age, and the other core vaccines will get boosted again in a year, and then it depends on your pet's lifestyle, basically. And if they, pardon me, sorry.
We have non-core vaccines for canines right now that we're looking at. So these are the ones that they don't have.
Not every pet needs these vaccines. It depends again on lifestyle. If they're going to be boarding, a lot of times we'll have them have Bordetella, and we're also doing a newer one, which is influenza. And leptospirosis is a disease that dogs can give people or vice versa. I've had a client who had leptospirosis and actually got it from his dog. So those vaccines, he was a cancer patient, so he was much more susceptible. So it depends on what's happening with the pet's lifestyle, their age, and, you know, are they going to be boarding or going anywhere too?
Right. Now we're talking about cats, because you brought your cat, Chester, and I'm sure Chester's up on all his vaccines. Let's talk about the feline core vaccines, first of all. Okay, these are the ones you absolutely have to have.
Correct.
Now, what is that first? I can't even pronounce it.
Panleukopenia, and that disease tends to have some respiratory issues, ocular and lung issues, and then calicivirus and herpes virus have other ocular issues and respiratory issues, and obviously rabies.
Right, and then we have non-core vaccines. Now, why would you want?
Well, with cats, ideally we want cats to stay inside. Some cats have higher exposure because they go on a patio, on a lanai. What if they escape? We have a big problem with leukemia and AIDS here in Tampa.
This is the first I've heard of feline AIDS. I had no idea. Now, why do we have a problem here in Florida?
Well, unfortunately, we have a lot of cats that don't have homes, or feral cats, and if Chester's to get out and encounter a feral cat, they may not be as well cared for or protected. They may have, if they're lucky in this county, have had one vaccine, but it's just not safe for Chester to encounter them.
Now, how would Chester get leukemia from another cat?
Leukemia, unfortunately, is highly contagious. Any bodily fluid from another cat, he could encounter it. Meaning if he was out on a pool screen, a lanai, and a cat came up and sneezed on him that was carrying the virus and was shedding virus, he could get sick from that.
I had no idea.
It's scary, and a lot of people don't realize it, and that's why I brought the cat today, because unfortunately as veterinarians, we don't get to see people's cats as often because in their mind they're healthy. And they don't need to come in, and it's frightening to me with hurricane season, because if you want to go to a shelter with your pet, you're going to have to prove that it's vaccinated. And
you don't have a whole lot of time to make that appointment. If you've got the evacuation notice and you try to get in to see your vet, then good luck to you.
But and accidents can happen. Cats can escape. You're bringing in the groceries. You know, stuff happens. The kids were out of school last week, and some this week. You know, cats get out. Dogs get out. We see most of our injuries, actually, when the kids are out of school.
And how often would you like to see people come in with their felines?
I would like to see cats once a year. Some cats, it's not necessarily that they're due for vaccinations, but they may need an exam and blood work so we could head off other diseases. Because I want kitty cat Chester here forever.
Of course.
Because I love him.
He obviously loves you too. He's a very happy cat. Wow, that's enlightening. Dr. Melissa Webster, thank you very much for that information.
Thanks for having me.
We'll be right back. Thank you, Chester, for being such a good cat. We'll be right back with more daytime, so stick around.